There is an easy clinical test for the neck when assessing musculoskeletal pain symptoms, including upper trapezius muscle sensitivity, trapezius hyperactivity, muscle aches, loss of neck mobility, and non-specific ongoing neck pain. Place sensors on the anterior and posterior portions of the upper trapezius muscles. Have your patient shrug their shoulders to contract the muscles. Observe the signal amplitude to gauge how well the muscles contract. Record 6 voluntary contractions. Place a selection over the data to compare left versus right sides and observe for significant variances in muscle activation. Now, have your patient contract the upper trapezius muscles using weights. Have them complete 12 shoulder shrug repetitions. This lets you observe how the muscle amplitudes respond to loading and fatigue. To review this data, place a selection over the first 5 repetitions of the recording. Make this data the maximal and select volume. Now, place another selection over the last 5 repetitions. Immediately, you can review an increase or decrease in signal amplitude volumes to assess muscle fatigue levels or increased function during the exercise test. Now test the sternocleidomastoids and posterior upper cervical rotator muscles. This test requires 2 clinicians to perform. Place sensors on the sternocleidomastoids and posterior upper cervical rotator muscles. While one clinician holds the sensors on the skin, ask your patient to rotate their head to the left as far as they can, comfortably. Repeat 5 times. Then repeat the same steps, turning to the right 5 times. Review the data. Compress the data on screen and place a selection over the recording. Review the amplitude of the muscle contractions to see how the muscles were working. Then select the left versus right tab and review comparisons in muscle activation left to right. This information is helpful to direct targeted exercise prescription of inhibited muscle functioning. This is an objective, repeatable clinical experiment to help patients with neck pain and targeted exercise prescription. Test the muscle functioning of the neck quickly using MR EMG.